guys. Okay, here we go. We're going to start the digestive system. The digestive system is really very simple. One long tube from the mouth to the anus. There's a couple accessory organs that we will discuss, but again, not too hard, pretty simple system to learn. Okay, so the digestive system can also be called the alimentary canal. Aliment means to nourish, so that's where alimentary comes from, or the gastrointestinal tract, or the GI tract. Not many people call it the alimentary canal. It's usually just the GI tract. The functions are to ingest nutrients, digest nutrients, absorb nutrients, and then defecate or remove the waste that was produced by the digestion and ingestion of the nutrients. Okay, we're going to start at the top with the mouth. So we know the mouth is just the entrance to the digestive system or the GI tract. It's just a mucous membrane-lined cavity. The parts of the mouth are the lips, or the medical terminology is the labia, basically to protect the opening. The cheeks form the lateral walls. The hard and soft palate we're familiar with. The hard palate is the front of the mouth, top of the mouth, or the roof of the mouth. You can feel the hard ridges with your tongue. Moving backwards towards your throat, you reach the soft palate, which doesn't have any ridges. Hanging down from the soft palate is the uvula. Okay. So the soft palate raises or elevates upwards when we swallow to prevent food and fluids going up into the nasopharynx, which prevents food and fluids from coming out our nose, which is a very unpleasant experience we don't want to have. And the uvula is what stimulates or enacts the gag reflex. So if you stick your finger down your throat, or if you're brushing your teeth and your toothbrush goes too far back into the back of your throat, you're going to gag. Okay, that is our body's natural mechanism to prevent us from swallowing before we are ready to swallow. Okay, because we need everything to be working properly in order to swallow properly so that we don't choke. Okay, and lastly, the vestibule is the space between the lips and the cheeks and the teeth and the gums. Okay, here's a nice picture of the mouth. Most of the items in this picture are easily recognizable to you guys. Upper lip, bottom or lower lip, upper teeth, lower teeth, hard palate. Here's the ridges. Moving back to the soft palate here, which involves the uvula. Okay, oropharynx, which is directly the space when you look into somebody's mouth. Directly back is the oropharynx. On each side are the palatine tonsils. Then we have the tongue. Okay, the tongue is a muscle we're going to talk about. The gums. Okay, medical term is gingiva for the gums. Okay, now these three little structures here, here, and here are all called frenulums. This is the superior frenulum. It attaches your upper lip to your gum line. This is the inferior frenulum, which attaches your lower lip to the gum line. And this is the lingual frenulum. This attaches the underside of the tongue to the bottom or the floor of your mouth, and it prevents your tongue from going too far backwards. Okay, the tongue. The tongue is a muscle. It's very important because it helps to move the food around in your mouth and then move it backwards towards your throat to initiate the swallow. The tongue is attached to the hyoid bone and the styloid process bones in the skull. So if you remember that little skeleton at the top of, or at the front of our classroom, the hyoid bone is the one here that kind of doesn't articulate with any other bone, but its purpose is to anchor the tongue. And the styloid process are the bones on each side. They come here, kind of below the ear on your skull, and they're a little point. And they also help to anchor the tongue. Again, here's the lingual frenulum that attaches that tongue to the floor of the mouth. And then, of course, we have the taste buds on the dorsum of the tongue, which is the top of the tongue. Here are the taste buds are laid out. Okay, specific areas are sensitive to specific tastes. So the tip of your tongue is sensitive to sweet things. The anterior sides are salty. The posterior sides are sour, and then the very back of your tongue senses bitterness. Okay? And I know a lot of you can experience or have had experience with the sour taste when you eat those sour candies like the sour gummy bears or gummy worms, Sour Patch Kids. You get that sensation, that kind of ache on the sides of your tongue when they're really sour. You're like, oh my gosh, those are so sour. You can actually feel it. Okay. The teeth. So, the teeth are an accessory organ. They aren't actually part of that one long continuous tube, but they do play a very important role. And their role is to break the food down in the mouth, start to break it apart. And that process is called mastication or chewing. Okay, to masticate is a fancy word for to chew. Okay, so we have two sets of teeth. We have our deciduous teeth, which are the baby teeth, and then we have the succedaneous teeth, which are your adult or permanent teeth. Okay, so here's the baby teeth or the deciduous teeth. So we have 20 baby teeth. So when that fetus is developing, there are 20 little tooth buds that form under the gums. Right? Then, after the baby's born, on this side you can see those teeth start to erupt, and it tells you typically, on average, what month or how old the child is when they start to erupt. And our front bottom teeth are the first ones that usually come out at about 6 months. Then, of course, all these teeth also fall out. And this gives you the age at which the teeth should fall out or be gone by. Okay. So how do we label these teeth? Top and bottom are the same. So we start in the front. Okay, we have our central incisor moving to the side or laterally, lateral incisor. Then we have our canine or our cuspids, first molar, second molar. And these are typically called premolar. Okay, so it would be a first premolar, second premolar. And it's the same on the top. Okay, it goes the same. All right, moving on to our permanent or our adult teeth or succedaneous teeth. We have 32 permanent adult teeth. Okay. And these works the same way as the baby teeth. These are our upper, these are our lower. So, central incisor, lateral incisor, cuspid or canine, first premolar, second premolar, then you have your first molar, second molar, and the third molar is actually the wisdom tooth. Okay, so you have 4 wisdom teeth. Some people, they never come in at all. Typically, if they're going to come in, they come in during the teenage years. A lot of you have experienced getting your wisdom teeth, and they always want to take them out. Reason being is there typically isn't enough space in the back of the mouth for those wisdom teeth to fit. So as they try to push their way through, they're going to push all these other teeth and make them crooked or twisted, or sometimes the wisdom teeth even come in sideways, as you'll see in the next slide. So to prevent any shifting of your permanent teeth here, they usually want to take those wisdom teeth out. We'll see the x-ray of the wisdom tooth at the end of this. So let's look at the actual tooth, the actual anatomy of a tooth itself. So it consists of 2 main regions. Okay, you have the crown and you have the root. The crown of the tooth is the part that is above the gum line. Okay. This is the part that you can see. It is covered with enamel to protect it. Enamel is the hardest substance in the body. Once that enamel wears away or is destroyed, it doesn't come back. Okay, enamel can't reproduce. All right, so that's when you're going to get cavities, nerve damage, etc., because you've lost that protective covering on the teeth. The root is the portion of the tooth then that is below the gum line that we can't see. The root embeds itself into the jawbone or the alveolar bone. It is protected and covered by cementum, and the periodontal membrane or the periodontal ligament is what helps hold it in place in the bone. Okay, so here it is a little bit closer. So here's the gum here. Okay, so everything above the gum line is the crown. crown is called the cusp. It's all covered by enamel. Remember that protective covering. Underneath the cusp, you have what's known as dentin, which is a softer material. And then inside the dentin is the pulp. The pulp contains the blood vessels, veins, arteries, and nerves. Veins and arteries are represented by blue and red, and the nerve is represented by the yellow. Okay? So, all this section below the gum line is then the root. So, here's the cementum that covers the root. All right, here's the dentin. It follows down in here. All right. Now, this is the bone, your jawbone or the alveolar bone. Okay, and this is the periodontal ligament that helps secure that tooth into the bone. Okay. Now, down here is the apex on each side. Okay. The apex is the opening that allows the blood vessels and the nerves to run up into the tooth. Okay, so this is what feeds the tooth, what keeps it alive, brings it nutrients and oxygen, all the stuff it needs. Okay, now, if you break a tooth, fracture a tooth, crack it open by getting hit or whatever in the mouth, or if you get a cavity that is severe enough, okay, that's going to open up, create an opening down into where it reaches the pulp and reaches this nerve, then it becomes very painful. A nerve exposed is very painful. And a lot of times, if somebody wants to save this tooth, maybe it's a tooth that you can't pull because it's seen when you smile or talk, okay, so they want to save that tooth, so they'll do a root canal where they go in and ream out all of this stuff inside the pulp. They take the nerve out because that's what's causing the pain. They only leave enough blood vessels to keep the tooth alive. Enough that will provide it just enough nourishment to keep it alive, or else it would turn gray and die and fall out anyway and defeat the purpose of having the root canal. Okay? And here's the x-ray. Okay? This talks about an impaction. They usually refer to wisdom teeth as being impacted, which means that they're still below the gum line. They have not broke through the gum line. This wisdom tooth, in fact, is coming in sideways. So they're going to want to take it out, because as it pushes, it's going to push all these teeth forward, and we don't want that. So that's why they typically try to take out your wisdom teeth. Salivary glands, these are very, very important because they produce saliva, and we need saliva in order to help break down our food chemically in our mouth and to make it easier for us to chew and swallow the food. Okay? So we have the parotid, the sublingual, and the submandibular. Parotids are on the side, submandibular are down here along the jawline, and the sublingual are underneath the tongue. Okay? And they produce and secrete saliva. Saliva is a mixture of a serous fluid, serous means clear, okay, and mucus. And this serous fluid and mucus contain enzymes. The most important one is amylase. Amylase starts to break down starches within your mouth as you chew the food and break it down. Okay, that's very important. It begins mechanical and chemical digestion of the food in the mouth. Saliva also contains lysozymes and antibodies. This is to help inhibit bacteria, because food is not sterile, and we touch it with our fingers. Hopefully we've done hand hygiene, but there still could be bacteria transferred to our food. So we need to have those somewhat natural defenses to help inhibit that bacteria before we eat the food and take it into our body. Okay, now this is a video that I put on here that covers the mouth, the tongue, the salivary glands. It's about 7 minutes long. You don't have to watch it, but I put it on here just as an enhancement to what we just talked about. So if you want to watch it, please do. Okay? And this is going to be the end of our first lesson. If you have any questions, please email me and tell me so that I can help to explain them better. Okay, guys. Thank you.